Since olden days, Bahrain community was known for its high birth ratio. Despite the simplicity of their life, conducting the deliveries was the responsibilities of the elder woman in the family, or if available, the traditional midwife known as Daya. The history of Bahrain is full with many traditional midwives' names, who despite of their non-scholar background were known for their expertise at that period of time. Among these names are Zainab Abdullah Abu Dris from Manama and Hashmiya Sayyid Ali from Malkiya village. The Ministry of Health had trained and certified some of the traditional midwives.
جو لها الصحة وراحت وياهم ودربوها هناك كلهم. دربوها عطوها شهادة. ثم يولدون يقولون أمي العودة ولدت أجيال يعني. ولدت تالي خالتي تالي أمي ما دربت إلا كبيرة. دربتهم هو. أي تالي يعني أقول.
The first trained midwife was Flora Jan, commonly known as Jan. In 1941, the first certified Bahraini midwife was Jamia Tawfiq. Since the 19th century, Bahrain government was striving to improve the health sector as they believe the development of the country lies on the health of its people. In 1958, the first government hospital was opened by His Highness Sheikh Salman bin Hamad Al Khalifa, and that is Salmaniya Medical Hospital. And other peripheral hospitals were opened like Muharrak Maternity Hospital, Jed Hafs Maternity Hospital, Sitra, Rifa, and Western Region. In 1976, the World Health Organization sent a consultant, Dr. Ingrid Niemann, to assess the educational needs in Bahrain. Therefore, the midwifery program was started in the College of Health Sciences after the declare of the regulating midwifery Amiri Decree number 24 in 1977. In 1978, the first batch of Bahraini midwives graduated from the College of Health Sciences, and Dr. Fakhriya Deri was one of them.
I heard lately that some of my colleagues, they enter to the interview to be a student at midwifery program. So it was very late. Actually, Saturday supposed to start the course. I just went Thursday. I said, I know I am late, but I would like to enter midwifery program. At that time, I was thinking about to have a certificate, to add more certificate to my specialty. So they did interview with me, and we had a quick exam. And I was told after a couple of hours that I'm accepted in the program, and Saturday I have to join the program. Even though we faced some difficulties, because at that time we were 9 students and we have only 1 lecturer. Action of the society towards midwifery at that time, I think it was very rewardable because we were Bahraini nurse midwife students at that time, and we are going to be Bahraini nurse midwife graduate. So people were accepting us. Why? Because the language. I think the language is very, very important when you are dealing with client who speak your own language. It's much easier for her, especially when she go through the pain. The way we explain to her, take deep breathing in from your nose, out from your mouth. The way we were giving back massage during labor, it helps a lot.
Mrs. Nadia Youssef worked as a staff nurse in 1982, a midwife in 1984. In 1985, worked as a midwifery program faculty in the College of Health Sciences, and had been working there as a coordinator of the midwifery program since 1996.
The program was running smoothly as it was developed in 1976, but in 1983, another consultant came from University of Illinois, Chicago, to Bahrain, and she reviewed the curriculum, and she developed a new curriculum based on the changes that happened in the midwifery role and in the country. When they started the program, there was no difficulty because the government supported the idea, and all stakeholders were happy to have a midwifery program here in Bahrain and to have midwives, national midwives. The problem arose later on when we have problem in recruiting nurses for midwifery program. Okay, this was our main problem for some times. So like for example, in some years we were opening the program, and then another year the program was closed because there were no candidates. But we tackled this by advertising for the program and by developing some solutions with the service. And the college and the service, they worked together, and one of the solutions was to give the graduates of midwifery program a grade immediately after graduation from the program.
In 1959, Salmaniya Hospital, the South Block, was opened by His Highness the late Emir Sheikh Salman bin Hamad Al Khalifa.
I joined as midwife since 1995, and I worked in old building, North Block, which we had a different setting than now. Actually, we had 5 staff per shift, plus supervisor who was covering during the shift. So the ratio midwife to patient was 1 to 3 patients, and 2 rooms where was the 6 patient there in labor, plus postnatal room and the high risk bed, which was 2.
During that time we had less deliveries, maybe 150, 175, sometimes 200. That's the maximum. Maybe about 7 to 10 cesareans per month it used to be, and our manpower was less that time.
As you know that previous time we were dependent on the main operation theater. They are coming to do for us the scrubbing and circulating. That times we are receiving the baby, as nowadays the midwife, they are receiving baby as baby nurse.
In M8 those days, all sick babies and all preterm babies, only midwives used to help pediatrician, and we are shifting the baby to neonatal ICU.
In 1978, the late Emir Sheikh Isa bin Salman Al Khalifa opened the hospital officially, and its name since then had become Salmaniya Medical Complex. 1997 marked the opening of the second phase of expansion in the medical complex by opening the new building by His Royal Highness Prime Minister Prince Khalifa bin Salman Al Khalifa.
We had common labor room, where the patients were not getting rooms separately. So then we thought that each labor room should have independent unit, and the family support is needed, so the husband or the mother could stay with the patient. That was the idea. So we wanted to have each unit independent with the full support of the relatives around. That was the idea.
Since 1996, we moved to South Block, and I believe because of the needs to have an individual department, as we have many high risk cases, it's increased from that time to now at present. So a lot I think it changed the setting itself, setting of the hospital, the structure. For us it was a new change. We can say we celebrated as it was a new change. We were proud to have a new department.
We are the first generation, Bahraini generation, who joined the new building, SMC, and it was established actually in 26 December 1996. So that times it was the transferring time. They were bringing their equipment, their items, everything from their old building, which is North Block, to the South Block. So I was that generation.
I feel maybe few changes happened with the equipment. Ministry of Health and our administration department, they try to supply as much as they can with the physical availability of physical resources. From that time till today, even though in spite of many deliveries and the number of deliveries increase, but I can say it's full equipped. The unit is full equipped with the advanced technology needs which can cope up with the cases which we have in labor ward.
The manpower, it was most of them it was expectory, around 90% was expectory, maybe only 10% was Bahraini that time.
We are working as a midwife. Our ratio is 1:2 patients, and we are in the shift is 7, and now recently it is increased to 8 midwife per shifts plus supervised.
Today, the Labor and Delivery Unit in Salmaniya Medical Complex is providing high standards of quality care for all citizens and residents of Bahrain.
I have 48 midwives, and with those 48 I have 8 supervisors, they are also midwives. And the number of delivery per day, it will reach 30 maximum per day, and per month above 500. And in 2015 the total delivery it was 6,498 cases. This one include normal delivery and cesarean section.
We are having also operation theater, operation A and operation B. Among of that we are having also a recovery room which can receive 2.
Our practice is safely protected by the available rules and policy set by Ministry of Health. We as nurses following nursing departmental policy and processes which will protect us and will allow us to provide proper nursing care to the patient.
There is a skilled nurse, Fatima. She is assisting the pediatrician for all the sick babies and shifting the babies to NICU. She is helping the pediatrician.
The responsibility of the midwife, it includes total patient care. Of course, we are receiving the patient who is in labor, so the nurse is responsible to take care of antenatal, intrapartum, postnatal patient. And in spite of that, our special procedure will be conducting delivery, and the midwife, she is witnessing, she is assisting the doctor for some special procedure like instrumental delivery. She is scrubbing, she is assisting for cesarean section delivery. She is doing a lot of things. There will be more changes. As you know that we are in the process to be accredited by the Canadian accreditation, and it is required from us to bring the changes, to do it and to bring it to the practice.
Actually, in my experience, what I learned about the basic skills of labor room was from a midwife who taught me how to deliver a patient in a normal way. So I trust them so much that if my daughter has to deliver, I will ask my midwife to deliver her instead of delivering myself or by other doctor. I trust them so much.
Where I work, I feel that they have the best knowledge, they have the surgical skills, and they always know when to call the doctors. We always feel that they are the detector of any complication that might happen to the patient. They are our hands in the labor room.
Midwives play a very important part in our life, and we cannot live without them.
I think the midwife in Bahrain, especially in Salmaniya where I work, they give the best care for the mother and the child antenatally, in labor and postpartum.
By their presence, they minimize the incidence of cesarean section, and they help the mother by providing them about all the instructions how to deliver in labor, and they provide nourishment, they regulate her vital signs, and in this way they encourage the birth to occur naturally. Like life partner, midwives are the life partner or labor room life partner for a doctor.
With the break of a new day, midwives in the Kingdom of Bahrain holds their hopes and visions to advance their profession and enter a new era in healthcare.
Hopefully in future we will have more Bahrainis who enter this program as we lack for it.
I hope that one day we will have midwifery-led care, okay, and we will have midwifery society or association, and we will be a member in ICM. By this, we will really improve our profession.
Try to upgrade yourself by reading more articles, criticize the articles, and involve yourself in research. And I always dream to have a research center in Bahrain.
My recommendation for the future midwife, to send them for higher study. We need a practitioner midwife to improve the practice. We need the midwife to have extended role rather than what she's doing. We need the midwife to take a bigger role than what she's doing right now. Really, I'm appreciating the midwife working in labor and delivery unit. They are working very hard. We cannot forget what they are doing. They are heart of midwifery.
It is great to be a mother, but it is greatest to be a midwife. As midwife, she's bringing a new life and happiness to this world.
Midwifery, it will give the happiness to most of the people.
Midwives play a very critical role in bringing up healthy babies, and if healthy babies are brought, they are future of this country and they are leaders of tomorrow.
Working as a midwife, it's a great job. This satisfaction you will not get anywhere. It is something very special. I invite all the girls, nursing students, everybody to come and joining labor room and work. Once you work only, you will understand the pleasure of working in labor room.
I am really happy to be a nurse midwife.
A midwife, and I'm proud, but there is no need to say it loud. Midwives see sadness, give kindness, see happiness and pain, support women and families, some who lose, some who gain. There are many facts to our role, and being good woman is in our souls. To be present as a child arrives is a true honor in our eyes. We hope, we give, we cry, we care. We are so privileged to just be there. It sounds a glitch, but it is true. There is nothing else I would rather do than be a midwife. As midwives' mission is to aid in bringing healthy babies who are the future and leaders of our Kingdom of Bahrain.